Coming up on Bodywork.
I do not like how big and saggy they are.
No, don't touch your nose.
You're gonna miss your boobs.
Oh my gosh, Kesha, it's beautiful.
And can we find the nipple?
I can change my face. I can touch it. Just like I'm just like you. I'm just like I guess you're more.
I've got 3 patients today. A nose job on a beautiful teenage girl, neck and eye surgery on an aging Casanova, and a facelift on a middle-aged woman. Kesha is 16 and wants her nose fixed. Some of her family think she doesn't need it. Alejandro Fernandez is 74 and wants to look younger so he can keep chasing women. His daughter wishes he would just stay home and act his age. Mercedes Frasas just turned 50 and wants a facelift. Her friends think she's risking her life for vanity. But to Mercedes, this is all about finding a new life.
Love the smell of Botox in the morning.
For most of us, it's about searching for the fountain of youth. That probably includes me.
I've never really liked my nose. I don't like the shape. I don't really like the size of it. Everyone tells me that I don't really need the nose job. I guess it's just the voice in the back of my head. It's always there.
Why is a girl that looks like this getting a nose job?
To boost their confidence.
Kesha Medea is a young lady, 16, who would like to have her nose fixed.
Me and my family are from Ohio, and Miami's a lot different.
We moved to Miami about 4 years ago from a little town in actually Canfield, Ohio. It should have been called Cornfield because there's nothing there but cornfields.
If I were still living in Ohio, I think I would eventually get the surgery done, but it probably wouldn't have happened when I was 16. When I moved to Miami, it was more of just a culture shock. You begin to realize how you looked.
I think that you don't need to have a nose job. I think that you're gorgeous, and I don't think people are going to be looking at your nose very often. I am Kesha's half-sister. Miami is obviously one of the hot spots of the world. There are so many gorgeous girls here when you walk down the beach that it's probably hard to be anything other than perfect. It's exactly the same. And now you're giving me a complex because I pretty much think we have the same nose, so like, should I be going to the doctor with you on Tuesday, or what's up?
She goes to a school where there's a lot of pretty girls, you know, and she feels, I'm like, you're very, very, like, beautiful, and she's like, no, I'm not. I go over, I'm average.
I feel sad that Kesha's not happy with her appearance totally.
I would like to see her wait until she's older.
Usted sí levanta peso, ¿ah?
No, no levanto peso, levanto mujeres. Peso ninguno.
Oh, that's great.
Es para llevar.
So he doesn't pick up weights, he picks up women. I love that.
Where you come from? Where you come from?
Where do I come from?
Yeah?
Here.
My father's a Don Juan. He has this attraction with women that they just all love him.
¿Cómo se puede decir? Soy como el marinero. En cada puerto tengo una novia. Hi.
I told him that 74-year-old man sit in front of the house in a rocking chair and watch the cars go by. He thinks I'm nuts.
¿Ves cómo bailo así? Y también me agacho. Y me levanto. Y le doy para acá.
People think he's my husband now. After the surgery, they're gonna think he's my son.
Alejandro Fernandez is like a hero. I want to be just like him. What I'm going to do is make the incision here, and I may make a T. Okay. To avoid having to make the incisions here, make them here and here. The neck and eye surgery I'm planning for Alejandro will be a quicker and simpler alternative to a facelift, because at his age, the risks are greater.
Good for me.
Everybody should be, this guy's muscles are unbelievable, huh? Look at that. There are people that come in who are 74, and all they're thinking about is when they're going down. This guy's, all he's thinking about is How much better can he look so that he can go carousing around? Is he my hero? Unbelievable. Okay, mucho gusto. Okay, take care.
Can you just ask her if she's gonna do the corporate run? All right. Thank you. Bye. Yes.
Every year we have this corporate run. The companies are allowed to design their own T-shirts.
One person tries to outdo the other.
So every year it's like a big hassle and everybody has an opinion.
So this year, Alicia, Adriana, and myself just kept it secret from everyone else.
This year they wanted to go a little different, a little sexier.
You know what I'm thinking? It's like just a before and after.
Corporate run pre and then corporate run post. That'd be great.
Okay.
I don't know what they're going to look like. I don't know if they're going to be halters.
Trust me, you're going to like it.
Okay.
Kesha would like her nose just to be less noticeable. She's a young girl who actually I wanted to introduce to my son. They're about the same age. Of course, my son and her would both be upset if I even considered that. But, you know, you can't be hurt for trying. Hey, how are you?
Great.
How you doing? Good seeing you. Now, how's your mom doing?
She's doing great.
Great, okay.
My mom has had surgery before. She's had a nose job when she was younger.
Kesha's mother I met many years ago when they first moved to town, and she occasionally comes in to have certain little things done.
There's just one area that you still have a little...
Yeah, just in between.
I believe that children who live with parents who've had some cosmetic surgery are more open to having cosmetic surgery.
You have a great-looking face, and your nose is really not, you know, I mean, it sort of fits you. Okay, so I'm gonna just take a couple pictures here. There we go. Great. Now, that's sort of what you want. This tip is gonna be a little thinner.
But is the tip still gonna be round? Because my mom's is really pointy.
Do you want, you want it more pointy?
No.
No, I didn't think so.
Okay.
I told your mother that she's got a very nice nose, but I didn't think you wanted that nose.
Yeah.
Okay, good. Because obviously, it's your face.
I think her getting a nose job is almost an easy way out of dealing with an issue. You know, because part of growing up and part of maturing is to deal with your problems and to overcome them yourself.
Why not wait 5 years for her surgery? I guess that's the question. And the reality is, it's peer pressure. 5 years on someone who's 16 is 30% of their life.
I don't think that just getting a plastic surgery is the best thing to do. I think that she should stick it out, and she'll realize how beautiful and how intelligent she is.
The thing I don't like about myself would be my chest size. I do not like how big and saggy they are. Right now, I'm a double D, leaning towards a triple D. It's hard to look at. I'm only 20 years old. I have huge boobs that are going to be to my ankles by the time I'm 40.
Come on in.
I think that Lauren's breasts are definitely too big for her lifestyle and for her age.
Lauren was not always big boobs. When she was younger, she used to be so flat-chested, just these mosquito bites. One day, out of the clear blue sky, like she woke up and she had the largest boobs I've ever seen.
I just want to take a peek. Now, how much bigger did you want? Just kidding.
Yeah. When I go out, I know the first thing that a guy is looking at are my breasts. It's like, hi, meet me. You know, I'm up here.
Usually in the young patients, their breasts are a little bit more dense, a little bit more firm, and definitely more difficult to get the shape the way you want them.
A reduction, it's intense surgery.
Initially, the way healing goes is that there's like this phase of healing where your scars look really not great, and then in about 3 months, they're gonna look the worst.
There's chances they cut a nerve and you lose sensation in your nipple, or you won't be able to breastfeed. Well, now my boobs are gonna have huge scars on them. You know, I'm not married. You know, what are guys gonna think?
Kesha's mom and dad are bringing her to surgery this morning.
You still nervous, honey? You need to take your appointment?
Good morning, Kesha. Hi, I'm Linda, the nurse. I'll be looking after you today. All right, come right out here. Kesha can go under this blanket here.
You nervous?
Yeah.
A little bit? Here's Mom and Dad.
Scooby-Doo.
Did it hurt?
No.
No?
Just freaked out.
Do you give her a pill of sedation?
Not beforehand. No, because Dr. Wolf wants to mark her, and he doesn't want her sedated, just in case she had any questions or anything like that. He'll be here in a few minutes.
You want out of it? You want out of it right now? All right, let's go.
Surgery is frightening, especially for young patients. Kesha seemed very nervous, and we thought she might change her mind.
Morning. Hello, how you doing?
Good, how are you?
Hello. You're all nervous.
Yeah, I can't tell.
What are you nervous about?
She's already researched it online.
It's a bad thing to do.
I know.
That's very bad. You know, this is probably one of the surgeries you never, ever want to see before you have
Yeah,
one.
it's gross.
Gonna make one little mark here. Straighten your nose. Before Kesha's nose surgery, I had to make sure she was comfortable with her decision. It looks much worse than it is. Okay, so I'll see you in a little bit.
A little scared.
She wanted to do it.
Oh, yeah.
Up until today.
Kesha's surgery entails essentially 3 or 4 steps. Taking down the hump, thinning out the tip a little bit, dropping the nose into the face, getting rid of this extra cartilage, and then obviously at the end, breaking the bones to narrow the nose, to straighten the nose. Can you put the table up a minute? You ever watch that movie, The Jerk? All I need is my headlight, my glasses, and my speculum. Elevating the skin over her skeleton so I can get under and do the work on the bone and the cartilage and all that stuff. What I just did, thins out the tip a little bit. I cut the cartilage from the septum. So we're gonna have to get rid of some of this.
Yeah.
I closed it thinking I'd taken enough, and then when I looked at it, I wasn't happy, so I opened it up and then took more. See this little piece? That makes a difference between a nice smooth nose and a little bump. Of all the surgeries that, at least that I'm involved in, that really give the people the willies is the nose surgery. When you look at it, it looks like it's just uncontrolled fracturing and breaking. That's it. Having a big nose, it's very distressing to younger people. They have parents who love and care for them and don't want their children to have any trouble in the world. And that's it. I'm going to section her out one time, okay? Kesha, it's all finished. You want to get the head and...
Don't touch your nose. Kesha, can you bend your knees? I need you to come over here for me, okay?
Stay on your
Come
back.
nice and slowly.
She's already trying to escape.
She's trying to escape.
Okay, there she is. Okay, now this thing here, you see? This is just a little drainage.
Oh, what's wrong?
I feel weird.
Oh, wait, come on, sit down. Oh, yeah, you feel a little... After surgery, Kesha's mother came to see her and got a little faint. This happens. It's not unusual. It's called a vasovagal. You're so shocked or you're so uptight that it sends a message to the heart to slow down, and it slows down so much that then your pressure goes down, and it's just a sequence of events. Okay?
Yeah.
Usually it's the dads. The dads are usually the ones that just go bang.
She looks great.
Yeah.
Yeah.
When she gets home, just give her the Tylenol.
How you doing? So now I have 2 to get home.
I'm so excited!
What did you get a picture of the breast sisters.
Wait, with Grandma, right?
Hey, Grandma.
Stick
your boobs out, guys.
Stick my boobs out now.
Stick them out more.
Well, I'm wearing a minimizer.
My grandmother has been large her whole life.
Lauren told me a while back that she was considering having breast surgery, and I was shocked to hear that all through high school they called her Jugs. That bothered me.
Do I think Lauren is going to get ditzier with smaller boobs? Is she going to be the same?
I think she's going to become smarter.
Me too.
Grandma, so if you were my age, would you be getting a breast reduction?
You know, it was not anything I would even discuss with my parents.
When I first told my family I wanted breast reduction surgery, they weren't surprised at all. They knew I needed it.
Are you going to miss your boobs? No, seriously.
No.
Have you thought about it at all? Do you
Yeah.
think you'll miss
In the
what you
mirror,
have?
I like hold my boob and I'm like, how will I look with this much boobie? I like lift them up. I'm like, my nipples would be approximately right in this vicinity.
What's the biggest thing you're really nervous about?
Waking, I just want to wake up.
She's anxious.
I'm scared about being put to sleep. I'm really good with dealing with pain. I just want to wake up. I'm very anxious.
You know what? It's, what, like 50 hours away?
Stop, that's making me scared.
I saw Joan Rivers was on Deborah Norville's show last night.
It looked like a freak. It was the weirdest thing.
I couldn't watch it. It was painful.
It is. It is that, absolutely. It's like the sushi roll of plastic surgery. They just keep adding. The more they think, the better. It's sick. It's crazy.
You can keep your pants on. Yeah, just take your shirt off. Socks, everything. Yeah, and you can put the little blue booties on.
You stay with me?
What's that?
You stay with me?
I'm staying with you the whole day.
Hey,
Is that okay?
Okay. Hello. How are you? Hi, nice meeting you. How you doing? Perfect, huh? He's always perfect, this guy.
Yeah.
Huh? He wants to do something that makes him look better, but not major operation. If I did this whole thing, the recovery is much longer for him. So what we're doing is we're modifying it. We're gonna do lipo, and we're gonna make an incision here, and take some of this extra skin forward and cut it out. That way we only have an incision under here as opposed to all through here.
Of course you worry, he's 74. Anything can happen. You could be 20 and have complications, but you can't hold him back.
If he weren't in good condition, I'd cancel him immediately. There's no reason. And things can still happen. But he's got more life than half the people that I operate who are in their 40s. It's true. Okay. Wrong chair. Okay, here we go. He's got pretty thick muscle here. How's his pressure? Everything looks good, huh?
Yeah.
That's good. When I do patients who are older than 60, 65, I'm always a little more on alert, and I will watch his blood pressure. Even though we have an anesthesiologist, I always tend to watch that because I want to make sure that we don't take any unnecessary risks.
I think his daughter was more worried than he was.
Small needle driver.
Small
Just,
needle driver.
just a needle driver, yeah. You know, I want to make sure that we don't get an infection there. Okay, that's it. Let's close it. Wrap it up here for the eye. Okay, so we're going to do the lipo now. We're not only going to just suck out the fat, we're going to cut a bunch of skin out. Thank you. It's not going to improve 100% like a full facelift would, but the risks are much less. The recovery time is going to be much less. And I think for men that age, time is of essence. You don't want to have somebody recovering for months and months and months. Look at that. That is impressive, huh? I mean, that's huge. That's like a facelift without a facelift. He is going to be one happy guy. That's good. I like it. It's a wrap. Alejandro, todo fue perfecto. Todo está bien. Buenas. Todo fue perfecto. Okay?
All right.
He did great. His blood pressure, everything was, better than 90% of the young people I take care of.
What's the pressure?
What's your blood pressure? 139/73. It's perfect.
73 hours.
You're doing great.
Like a baby.
Like a baby.
You take care of me.
Okay. Jessica, do you have any requests for the corporate run?
Beer, strippers, hot tub.
The usual.
The usual.
I got the t-shirts. T-shirts, yay! Okay, go away. Go away. The problem is, they look small. By me. Is everybody ready? Yeah. Ta-da! Oh, this is the front.
Are those the small ones?
And this is the back.
Yeah. That's good.
I'm just like.
Hello.
Hi.
So you excited? You nervous? What is it? Nervous?
Great.
Who's here with you?
My mom and dad and my aunt right now.
Okay. As soon as Linda has that all taped in, I'm going to draw on you, measure a few things. Developing trust with a patient is a very difficult thing. I think that you have to establish a relationship with the patient to get to know them. That relationship is very important to the success or failure of a surgery.
I marked where things are, where well you're sitting, because you're going to be lying down during most of the surgery. Just like make sure everything's level. It's like building a house. You know?
My dad.
He'll be happy to know that I'm using the same tools he uses to build a house.
The markings that we make in a breast reduction surgery are really critical, because if you don't get those marks right and know where things are supposed to be at the end of surgery, it's never going to come out right.
Lay back down, relax for a couple minutes, and then we're going to get started, okay?
Hi, honey.
When a patient comes in and you see that they're there with their whole family, they're concerned, and rightfully so. This is surgery.
Hi.
Good morning. How are you? Good.
Are you the anesthesiologist?
I am. Nice to meet you. Ferguson, man.
You take good care of her?
I'm sure.
Okay. Tell you that she hates being nauseous, right?
Good,
That's like one of her biggest fears.
Okay.
Take real good care of her.
We will.
Sweetheart, what do you want? Want to feel her?
Okay, Lauren, we're ready for you, baby. Yeah, she's gonna walk in.
Love you. Everything's gonna be great.
Lauren's family, right off the bat, I got a great feeling about them. They're incredibly supportive.
See the minute he comes back, okay? Don't worry, we'll take care of you, baby. Dr. Herman, we're ready, number 1.
My name's Mercedes. My friends call me Mercy. I am not gonna grow old gracefully. I'm going to go out kicking and screaming. I'm having my eyes fixed so that they don't look so tired, and I'm having my chin refurbished. I look in the mirror and this 50-year-old lady looks back, and that's not how I feel. Next time you see me, I will have a new face. I am a legal assistant. I work for a large corporation. In any profession, looking young is important. What would I do looking more confident? I might go for another position that pays more, but I will not look my age. I'm going to make them guess, and guess hard.
I believe that you're just fooling yourself. Yes. Because the years are still going to pass.
We have some friends, family, that do not agree with the surgery. No amount of exercise and diet will do what a nip and tuck will do.
Yeah, but there comes a time when if you keep on nipping and tucking, you're not going to look like yourself.
Mercy has always been striving for that fountain of youth. And I keep telling her, Mercy, you know, we're going to get old anyway.
I think plastic surgery, you could say is a fountain of youth, but really it's a fountain of mental youth. Hey, how are you?
Good to see you.
And what we're going to do is we're going to get rid of all this extra skin. We're going to get rid of all this by liposuction, but in order to get it up, we're going to lift it here. So tell me, you're doing all this surgery. What kind of motivated you to do everything?
I turned 50. I got so many friends that really don't agree with it, that they're kind of freaking out.
It'll be interesting to see how her friends react, because at least in my eyes, it's successful if the people that didn't want them to have it done really think, you know, boy, she looks good.
Lauren's going to undergo a breast reduction. Her breasts are very large, pendulous. They're hanging pretty low, so we're basically going to raise them up, make them smaller and perkier. Perfect, right there. We're good to go. Come, Mark, come. You never knew what it's going to be, right? Let's see if you get in here. The breast is really made up of two things. It's solid breast tissue and fat. We can get an idea before surgery of what each individual person's breast is made of, but until you get inside there, you don't know.
Lauren's surgery started like at 8:30, so we're counting down. Her biggest concern is really she's going to be puking when she wakes up, right? I mean, that's her biggest concern. She hates puking.
You know, it's funny. I thought the right was larger initially by 50. But then when I measured her today, she didn't look bigger. I prefer to remove the excess breast tissue from the outside or the lateral part of the breast, leaving the upper part and the middle part full so that they still look round and perky. And can we find the nipple?
There's
it's right there. Look at that. We found the nipple today on the first shot. Voila! 2 pink nipples. Skin looks good. Call it a day.
Bend your knees.
To the right.
Do you feel sick or anything, Lauren?
Hey. How are you?
How do you feel?
This sucks, huh?
He said he took out over 2 pounds. Yep.
Over 2 pounds. Look down.
No.
Why not?
Too painful.
My parents would not approve. If it was up to them, I would not have the surgery. They don't think I need it. They don't want me to put myself through an operation.
Morning. How are you?
I'm fine, Dad.
Good.
I
You
can't
doing
wait
okay?
for this to be over.
Well, that makes 2 of us. That means I can get home.
I don't want my natural smile to be ruined.
You mean you don't want to look like this? You sure? Oh, then you're in the wrong place. that's my favorite look.
I've seen some people look that
Right.
way.
No, I agree with you. I have no desire to
I
do
would
that.
pay not to look that way.
Well, that's what you're doing. Look up. Un placer. La vamos a cuidar bien. Muchas gracias. Take good care of her. Okay? That's it. Plastic surgery, it's sort of the key to a better mental health, a overall youthful feel and look.
That's cool. We're ready to work too.
Yeah, just keep it in there for now.
Is that what it's been?
Just wait for her.
Oh my God, this is unbelievable.
Hello.
You know, your pressure's slightly elevated. Just relax. We're gonna just check it out. Mercedes' pressure is a little elevated, and so it could be from the epinephrine when we inject. So we're gonna see how it goes, and if it's not right, we're not gonna go with it. Yeah, I certainly don't want to do anything that's gonna put her at risk.
I guess we all want more. I guess we all want more.
That's perfect now. Everything's perfect. Mercedes' pressure came down right after we got into the operating room. If it goes up and down during the rest of the surgery, we may have to rethink it. You see, we use nothing but the finest equipment here. to have one eye done and not the other.
Okay, shell out of that veins, the little famous veins.
She's right away. I agree with you.
In and out, Mercedes.
Mercedes, remember, we like breathing. Oxygen is good for you. You're not feeling any pain, right? You're just nice and comfortable? Good. That's what we want you to be, is nice and comfortable. As you see, I'm cauterizing. So I'm creating a burn, which stimulates scarring.
Do you smoke cigarettes during surgery, or what's all that?
Yeah, we do.
He's making signals.
I'm making signals to you.
Oh.
And you came in just in time. This is such a nice look, isn't it? You see, you got rid of the volume here,
Yeah.
the little skin, extra skin. You can just see there's not all this extra tissue.
Muy bien. Ella me fue colegio, quisiera que se hiciera la papadita toda aquí. Ella tiene miedo, yo quiero que
I finished Mercedes' eyes and began to do the work on her facelift. I started by doing some liposuction on her jowls. See, now you can see she's got a neck. I think everybody wants to hold on to their youth because we don't want the party to end.
Your middle
The
face.
incision looks nice, huh? Look at that. Okay. Mercedes? Mercedes?
Mercedes, we're done.
We're finished.
Hey.
Mercedes. Surgery's over.
I think everything went okay.
Everything went well.
Good. We were just talking before that this year, I graduated medical school 20 years ago this year.
What year?
1984.
Oh, then mine's 21 years ago. Depending on how much sleep I get, or depending on how I look, I start trying to figure out which of my partners is going to have their way with me surgically. I just think if I can hold out with the non-invasive procedures, I will continue to do that. Working here, I'm inspired to stay young.
Kesha?
Okie dokie.
Hello, how are you? How you doing?
A little bruised.
Fantastic, huh?
Oh yeah, I feel like it.
We're gonna take the packs out, and I think we're gonna even take a look at what you look like.
Ew. Are packs out?
Kesha's mother got faint when she saw her daughter after surgery.
Is it gonna hurt?
Nothing, so far nothing's gonna hurt. So I'm worried she may pass out when I take off Kesha's bandages. Jump relax. Did that hurt? We're just gonna clean all this.
She's gonna faint.
Ow,
ow, ow, ow, ow, ow, ow, ow, ow.
That's it.
Maybe I should have taken those painkillers before I came.
Do you want us to keep the cast on?
No,
Just
but
let
I'm
it fall off
scared.
naturally?
I'm just like you, I'm just like...
Maybe I should have taken those painkillers before I came.
You want us to keep the cast on?
No,
Just
but
let
I'm
it fall off
scared.
naturally? It's not gonna be bad, though. Just relax. Close your eyes.
Are you gonna count or are you gonna just give me?
Okay, just relax.
Okay.
You're so sensitive.
Ow, 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 ow.
Wasn't that a cute out?
Oh, yeah. I feel really cute right now.
Don't look. Don't look. Let me see. You see? Okay, take a look, Mom. I'm gonna let your mom see first.
Oh my gosh, Kesha, it's beautiful.
Wow, I'm really swollen.
Very swollen up here.
Yeah, I feel like a dinosaur.
Some kids are very quiet and they don't say much, and I sort of wonder, well, is she happy or not?
It's really swollen.
Yeah, you're very
Big.
swollen.
How are you? Right in here. The first couple hours when I got back to the hotel were a little rough.
Go ahead and change for me, Dr. Herman. It'll be a few minutes, okay?
Okay, thank you.
I looked a little bit, but I couldn't really see much.
Good morning. How you feeling? Good. You slept okay last night?
Yeah.
You ate finally?
Yeah.
Good. Good. You ready to take a peek?
Yeah, I think so.
You think so? Okay, let me take this off. A little sore on the sides there. I'm really not sure if Lauren is happy or understands the size of her breasts yet. It's such a dramatic change initially that I think that it's going to be a few weeks before she feels comfortable with her new look. You may drain some fluid from where the incisions are for the next week or so. It may be a little yellow in color.
Okay.
And these purple pen marks that I drew all over you, those wash off in about a year.
Did you see it?
Down. My boobs didn't look like boobs.
I see about 20 to 30 patients a day. I do about 6 to 8 facelifts a month, and I do several hundred noses a year. I'm pretty busy. Mercedes Frasas is coming in. She's 6 days post-op. Today we're going to take out most of her stitches. Hello, how you doing?
How are you doing?
Good.
Good to see you.
Well, you look all spiffy this morning, huh?
I'm going to work right after here.
Are you?
Yeah.
She's really eager to get back to work. Apparently, she's very anxious about taking time off. She feels that her employee is very dependent on her.
They have no idea I just had surgery, so that's going to be quite a surprise to them.
Is that right? That is so funny. I'm going to press this here. You have a little bit of fluid. What I'm going to have you do is just lie back down here and put your head slightly up. Perfect.
My body, it felt like it had been run over by a truck.
Okay, so that's that. Now I'm going to take a couple of these out here.
I felt fatigued. I felt like I had been to a traumatizing event. I felt like I really needed more time to recover because it is a big surgery.
Take it easy at work, though. Most people aren't going back to work at 5 days.
These are so that I can see.
Okay, no, in fact, that's great because they hide what you have right now, which is still a little swelling.
Corporate run is finally here, thank God.
These shirts are awesome.
And I have a feeling that we just may win.
I'm gonna give other people a chance to win this year since I'm pregnant.
Bye, girls. Anything, call me in the cell.
The corporate run was a great experience. I think it's probably the best corporate run we've had as a practice.
The corporate run raises money for leukemia research.
I don't see anybody. I don't need them.
Feels good.
First place, most original t-shirt goes to Miami Plastic Surgery. Congratulations.
Time to recover because it is a big surgery.
Take it easy at work, though. Most people aren't going back to work at 5 days.
These are so that I can see.
Okay, no, in fact, that's great because they hide what you have right now, which is still a little swelling.
Corporate run is finally here, thank God.
These shirts are awesome.
And I have a feeling that we just may win.
I'm gonna give other people a chance to win this year since I'm pregnant.
Bye, girls. Anything, call me in the cell.
The corporate run was a great experience. I think it's probably the best corporate run we've had as a practice.
The corporate run raises money for leukemia research.
I don't see anybody. I don't need them.
Feels good.
First place, most original t-shirt goes to Miami Plastic Surgery. Congratulations.
¿Cómo estás? How are you?
This is my girlfriend.
Your girlfriend?
Yeah.
I gave Alejandro neck and face surgery so he could keep carousing around. Is she younger than I?
I think so. I think so.
I figured out how to meet one of your young... When Alejandro used to talk to me about his women, I used to, you know, take it with a little grain of salt, but I'm convinced he's the whole enchilada. See, it's definitely much improved. See, he had this all falling down, so it's much better.
Every day I see my face better. I look young. Oh, yeah. I'm happy.
I believe my father's a Don Juan from the movies.
Hopefully I'll be doing his surgery when he's 90. Maybe at that time we'll do his full facelift.
If he can go out and party tonight, he's gonna party tonight, and if he goes to sleep and doesn't wake up tomorrow, he has no regrets.
It's been 5 weeks after my surgery, and I decided it was time to reward myself. My best friends, Ellie and Sonia, are coming over to help me pick makeup.
Hi, how are you? How are you doing? I'm fine, and you?
Good. Let me see without those glasses. Okay, here we go.
Wow. Look, you cannot see
I feel like the
anything.
Bride of Frankenstein.
Mercedes' results are phenomenal.
I love everything about my new face.
The surgery was absolutely worth it, even though I know I'll be paying it off until I'm 100.
Are you happy?
I'm very happy. I'm very happy. There's a lot of inflammation still, but you know, I can tell that it's gonna be really, really, really nice.
Yeah, she does look better. Now, going through the surgery for it, I wouldn't, but she does look better.
I've been offered several new, highly compensated jobs, and I'm in the midst of deciding which one I want.
Once you hit 50, people say you shouldn't chase a fountain of youth. But Mercedes has a lot of living to do, and she wants her appearance to reflect how young she feels.
Feeling beautiful and sexy changes your whole life. I want to be out there. I want to be out there living.
It's been a month since my surgery, and I feel great.
Lauren, this one looks like it should be gorgeous. I love the color, the blue. It would match your eyes.
I think that as she is less defined by her breasts, her personality is going to be able to come out, and she'll be more Lauren rather than just the girl with the big breasts.
Isn't that kind of revealing?
Since I'm no longer the girl with big boobs, I just think that people can really focus on who I am.
I still can't believe you fit into this. I cannot believe that you are wearing this bra right now.
I just don't remember how big they used to be.
Lauren, they were ginormous. Ginormous.
Well, your nose wasn't incredibly horrible. You didn't have like this
horrid cause.
So you feel better about it?
Yeah, I'm comfier because I didn't like my nose, but like I was never like I never was like suicidal about it. Like yeah, it made me unhappy, but like
before my nose was like very unique and individual. Now it's tiny, it's more perfected. I guess I just see my face for what it is, minus the messed up nose.
I think that you guys, especially too with the teenagers here, there's an incredible pressure.
For a beautiful girl like Kesha, a nose job is just icing on the cake. When you're young, a physical flaw can cause emotional damage. Why not avoid the problem with plastic surgery?
I don't know what she's gonna be like after living with that new nose, so I don't think it'll affect the relationship. I hope not, but that's something that time will tell.
I think she'll grow up to be a really strong, successful, fun person.
I think Kesha looks good enough to introduce to my son.
I can just tell from her face that, when she looks in the mirror, it's like, yeah.
Since the surgery now, I can look at other things like my hair, for instance. I just cut my bangs last night.
Okay, Dr. Wolf, let's call it a day.
I'll tell you, I'm exhausted.
Me too.
Let's go. At least we saved another nose today.
Sure did.
There's no place I'd rather be than Miami. It's paradise, and we make paradise beautiful.
I'm just like you, I'm just like I can change my face, I can touch and taste just like